All right, you're good.
All right, so today I'm going to be doing just some different screening tools that I would do if I suspected someone had a headache. Mainly the vestibulocular examination, so I'm going to be looking at extraocular range of motion, smooth pursuits, cadec eye movements, convergence, and then the vestibulocular reflex. So first, for the extraocular range of motion and smooth pursuits, I can kind of knock them both out at the same time. I have them simply follow my finger. So with this, this patient here, he seems unaffected as the pursuit is a little bit of nystagmus. But what I'd be looking for is, can they follow it smoothly? And is there any deviations of eye movement and any sort of nystagmus going on? Any pain with that?
Sure.
Good. So if I was to treat someone with that, I would just have them practice that maybe in a shorter range. As they go, I would go farther and farther. That way we can work on their ocular range of motion. For saccadic eye movements, so what I'm going to have you do is when I click my tongue, I want you to move from one finger to the next with just your eyes, okay?
Mm-hmm.
So this was a negative test, nothing seemed crazy, but what I would find on an abnormal test would be, again, that nystagmus, or it's not as smoothly done, or if there's any kind of reproduction of those symptoms. And I would also treat that with, again, just having them practice it, maybe in a shorter range, and then moving farther and farther, working on that saccadic rhythm. For convergence, I'm going to have the patient I'm going to move my finger closer to your nose. You just follow it. Let me know when you see double. Okay?
Right there.
Okay. So an abnormal finding would be anything beyond 7 centimeters from the nose, but this was way less than 7 centimeters, so this is normal. A good way to treat this, if it was beyond 7 centimeters, is by doing the pencil push-ups, so just having him take a pencil and just following it closer and closer until we get to be below that 7 centimeters, which is our normal reading. And then for the vestibulocular reflex, I want my patient to focus on my nose and turn his head from side to side. Okay? So nothing there screams it's abnormal. Something we would look for abnormalities is, again, nystagmus or any of that reproduction of the symptoms. Good way to treat that is by the VOR times 1 times 2. So for times 1, I would have the patient just turn his head, shake his head at about a 25-degree angle, trying to focus on his thumbs. And then for a VOR times 2 as a progression, whatever direction his head turns, his thumbs move the opposite. And I would just do that in that same range, trying to work on that VOR to improve it. And that's kind of my vestibulocular examination for someone with a headache.